Hello, everyone. Thank you for joining the RBM SBC Working Group General Call today. I'll just give another few seconds as I see people entering the call. Great. Hello, everyone. Thank you for joining our call today. This is the RBM SBC Working Group General Call. My name is Gabrielle Hunter, and alongside Mariam Wamala Nabukenya, I serve as the co-chair for the working group. Can we have the next slide, Ashley? Thanks. It's our pleasure to welcome you today. Our call will be interpreted into English, French, and Portuguese. Next slide, please. So please go ahead and select your language for interpretation now. We will actually have all three languages speaking today. So you can also follow along with today's presentation slides in English, French, or Portuguese by going to the link that you see here at the bottom of the slide. And we will also share that link in the chat so you can download the slides in your language and follow along if you'd like. Our coordinator, Ashley, will send out the slides in all languages with the recording after today's call. And as everyone is now joining, please go ahead and introduce yourself in the chat box now. You can share your name, affiliation, and country. I do see many familiar names in the participant list, but please go ahead and introduce yourselves as well. Next slide. Thank you. Well, let's dive in. The agenda for today's call includes SBC working group updates from Ashley Riley, the coordinator, and then we will have two technical presentations on today's theme, which is school-based malaria SBC. And I just wanted to note that this is a topic that you, our membership, have expressed on multiple occasions of being of a big interest. Those who were at our annual meeting in Abidjan last year will recall that we'd agreed to host webinars on some of those priority topics that were highlighted by the participants at the meeting. School-based malaria SBC, as well as multi-sectoral programming, were two of these topics. So we are very pleased to feature this work today in an effort to meet our members' interests. And we're also very pleased to have these two special guests sharing their work with us. After those presentations, we'll have question and answer period, followed by some closing remarks. So since we've got so much to cover, I will go ahead and pass the floor to Ashley Riley to go into our next agenda item, the working group updates.
Thank you so much, Gabrielle. I am so pleased to announce that the 11th annual SBC Working Group meeting will be held from September 11th to September 13th this year in Nairobi. The annual meeting is an opportunity to convene malaria SBC professionals to share experiences in malaria SBC, participate in skills building workshops, discuss emerging issues, and set the working group priorities for the next year. As always, interpretation will be provided in English, French, and Portuguese during the annual meeting. Abstracts are due on May 29th through the abstract submission portal on our event website, which you can learn more about in the chat. I will post it here in a moment. The link is also on the screen. Registration will be announced through our email list and will be available on our event website in July. Space will be limited and the registration fee will be $250. There are limited sponsorships available specifically for National Malaria Control Program members. The application is now open. Everyone should have received an email earlier this week with the application. National Malaria Program staff can apply for sponsorship by filling out that application. And I will also put the link in the chat in a moment. The deadline for National Malaria Program sponsorship application is May 24th. I will now pass the floor to Mike Toso of the steering group, who will begin today's technical program. Over to you, Mike.
Thank you so much, Ashley. Today, we're fortunate enough to have two technical presenters on the topic of school-based SBC for malaria prevention. Please note that you can follow along with today's presentations in English, French, or Portuguese by clicking the link on the screen and in the chat. Please share your questions by typing them into the chat. We will have a question and answer session after today's technical presentations. First, welcome Dr. Tiana Ramanathirai, Madagascar National Malaria Control Program, who present a malaria-focused competitions in schools. Dr. Tiana, the floor is yours.
Hello, everyone. It is a pleasure for me to explain to you the school-based malaria program. Next, please. Next one, please. On our friendly school competition on malaria prevention, we have the background. The situation in Madagascar in 2017 and 2018, you can see that we have school-age children that suffer from malaria. For children that are 15 years old and less are suffering from malaria. In this context, Madagascar decided to create a competition, and it's also on our strategic plan, which is entertain to educate. And in this context, the idea is to entertain children to be able to educate them better and make sure that they are aware, and we are creating awareness among students in the schools. Next one, please. In the same idea for the background, all the activities that we were doing for the national program against malaria, we can see here that the strategy, there's an awareness campaign for adults. We have community dialogues for all the people that are in charge of children. But then for school-age children, we don't have many activities. So this is something that makes us want to do this activity for schools. This competition on malaria prevention. The idea is to work on the 41 districts and with our program, and we are also including 13 districts that are the elimination districts, the districts that are actually almost eliminating malaria. During this competition, they have different prices. We have the malaria campaign materials, tools, and supplies, but we also have specific prices for this specific activity. Next one, please. Before starting our competition, we had a preparation for this activity. We did an advocacy and cooperation with the ministry. We also had information sessions at different levels, at the central level, at the ministry level, at the region level, that would do the competition, at the district level, and also at the community level. The community where the different schools are located. We also sent out information about the competition, all the guidelines. We also selected the winners according to the guidelines. We also selected the jury, and for the best schools that were participating on this competition, we also selected different winners, and then the delivery and official prize giving. Next one, please. I will now explain what we did exactly for this competition. During the school year 2019-2020, the guideline said that they had to create a video sketch. During this year, the public schools and private schools at a primary level, the elementary schools, were the ones that were authorized to participate in the competition. In 2020 and 2021, we changed our guidelines because we received feedback, we received all the information from schools for the school year 2019 and 2020, and they told us it was difficult for them to do the video as a support. So we changed our competition and we did a drawing competition. So for the elementary and high school level, public and private, we sent different guidelines saying that they had to do a drawing competition with a question. How do you protect your family against malaria? During that school year, we had the COVID context. So this actually was a problem for us. It was a barrier. We were impacted by COVID because of this specific year. During the year 2021 and 2022, we read we did the competition again, and everyone could participate in this competition. Next one, please. What we used for our advocacy activities, we use different information, different brochures. So we showed our strategy, and you can see all the strategies that we're using here in Madagascar. And we explained how to prevent malaria, all the information about prevention, what to do when you're sick. So this information was critical. And then we also had the brochure specifically for teachers. And before drawing for the competition, the teachers needed to create awareness among students. They needed to tell them for them to understand what was malaria specifically. They had to do it in in the school centers, but they also had all these supports like the awareness poster, the brochure for teachers, and they also had school health officers that were validating the information and all the supports used for schools. Next one, please. So for our supports available for this competition, we had the guidelines for teachers. And in these guidelines, we included the strategy for fighting against malaria. And then for schools, we have these posters that we had to put in specific places where there was a huge concentration of students and where we could motivate all the students. And also we wanted to give them certificates of participation for those who won the prizes. So those were the supports available during the competition. Next one, please. For our competition outcomes, during the first year of the competition, we had 41 vulnerable districts that participated in the competitions, mostly public schools, and more, so it was about 200 schools that participated. 176 of them were public schools and 24 private schools. The number of private schools were all present. During the second year, we weren't able to really continue with our competition. We had to stop in the midst of the competition because of the COVID pandemic. During the third year of the competition, we had 54 districts participating, 41 vulnerable districts, plus the 13 elimination districts. And in total, we had elementary schools, 59, then 33 middle schools and 2 high schools. In total, we had 94 schools participating in this competition during our 3rd year of this activity. Next one, please. So the competition results again, during the first competition, we had received 1,660 drawings. Because in the guidelines, we had to create awareness among students. We were able to reach more than 8,800 students. In 2000, for the 2nd year, we had reached more than 33,000 students. And the drawing team, they use sanitation in and around the home. And then other themes that were used of the use of mosquito nets, repellent methods, and then a little less about intradomestic spraying and early treatment. We received really few drawings about those specific topics. Next one, please. If we speak about the participation of different schools to this competition, 1/3 of these schools were participating in this competition. One drawing sent meant one child that was educated on malaria. Then we had also the contribution to improving examination results. During, for example, the public elementary schools, we had a 96% success rate on the exams. And then the same for the middle school. We had 86% success rate for the school that has a general method. We were able to create awareness among students here in Madagascar. And for us, it's like the disease that is the most prevalent here at the schools. We have different diseases, which are malaria, diarrhea, bilharzia, and parasitosis. Next one, please. We had multiple successes, but we also had some challenges. For the challenges, well, we already spoke about them, but the effective participation of all public and private schools in the target districts is not effective. We also had issues with the follow-up on the adoption of these behaviors by school children after the competition. So for us, these are the biggest challenges when we create this competition at the school level in these different districts. Next one, please. What is available for us or for our follow-up when we have the officials from the Ministry of Education and Health, they were able to create a follow-up, do monitoring on the different participating schools. And then we also had the class attendance sheet, and we were able to see that there is an improvement concerning the drop-off of school. So for us, it was a success. Next one, please. Our conclusion. Thanks to our competition, it was a different way to empower the next generation in the fight against malaria. We also had diversification and expansion of targets, and we're able to multiply the awareness among students in the school. This competition was aligned with our approach, which is entertain to educate. And we were able to also empower all levels, because during this organization, during this competition, we were able to work at all the different levels, community level, local level, national level. And we also were able to collaborate with the Ministry of Education to change the lessons on malaria, which is 8th grade. And we were able to update for example, the name of the medication that we use for malaria. And we were able to change the name of the medication in the school books. And now we have all all the information that is updated. We don't use chloroquine anymore. And we were able, thanks to this approach, we were able to change the name and change the lesson that they have, and update this class that they do at the 8th graders. Thank you very much. That was my presentation, and thank you very much for your kind attention.
Thank you so much, Dr. Tiana, for taking the time to share these valuable experiences with our working group. It's great to see collaboration between different government ministries, and likewise, it's great to see involvement of both public and private schools. We know that as we near malaria elimination, populations at risk may change, and strategies to reach older children and adolescents become increasingly important, particularly as school-age children are increasingly recognized as a reservoir for asymptomatic malaria infections. So this is all very important work. Please continue to share your questions in the chat. We'll have a question and answer session after the next presentation. Next, we have Dr. Olushola Adoye from Johns Hopkins Center for Communication Programs Breakthrough Action Nigeria project. We'll be sharing what was learned about promoting positive malaria behaviors through school health clubs. Dr. Olushola, I'll pass the floor over to you.
Thank you very much, Mike. Hello, everybody. I am privileged to be sharing about what we have done in engagement of the school health clubs in Nigeria. Next slide, please. It's no longer news that malaria is, Nigeria has a very high burden of malaria. According to the World Malaria Report of 2022, Nigeria is about 26.6% of malaria cases and 31.3% of the deaths. And we also know that the school enrollment rate in Nigeria is quite high. And education is compulsory between the ages of 6 and 15. This means that children tend to stay in the schools for a very large chunk of time between 8 a.m. and 4 p.m. across several states. We also know that the World Malaria Organization supports school health promotion and school health education interventions, because they know that the teachers are guides or are role models for these children, and they encourage the formation of very vital life skills. So we decided that because of these reasons, we would engage schools in our bid to increase positive malaria behavior. School interventions have a multiplier effect, and literature has confirmed that students tend to influence their families, their neighbors, their friends towards healthy practices. Next slide, please. So what were our objectives? We wanted to promote healthy malaria behaviors among students attending health clubs in secondary schools. We're trying to ensure that through building of the capacity of the students, they would become champions and advocates of health. We targeted school health clubs because we were looking for a fun and interesting interactive manner to engage the students while educating them and building the capacity in terms of health. We also wanted to strengthen the collaboration between the Ministry of Education and the Ministry of Health, particularly the malaria control program at both the state and national levels. So we targeted 3 states. These states were part of the USAID President's Malaria Initiative funded states, Oyo State, Benue State, and Cross River States. These 3 states, because they have very high school enrollment rates and very high educational or literacy levels, more than the other states that were being supported by our funders. We engaged 31 secondary schools in 6 LGs across those 3 states. And we were hoping that through this avenue, the students will want to be members of the school health club. So we conducted a feasibility pilot for a full school year. Feasibility pilot because it was our first time in the projects at Breakthrough Action Nigeria of engaging the schools, and we're hoping that we will use that full year to get lessons learned and then expand to other states and more schools. Next slide, please. So we basically had 4 approaches. Our first approach was to collaborate with the educational sector, like I mentioned before. So we created 3 state school SBC implementation teams, the SITs, who would provide oversight function over those school health clubs. The members were made up of representation from the 2 main ministries of health and education at the state level, as well as the LGA levels. And we started off by training the health teachers and vice principals of those 31 schools. We also developed a teacher's guide on malaria and life skills. Now, we were focused on malaria because we're implementing on malaria SBC. And we included the life skills because we felt that the children will find it interesting. So we had topics like time management, we had peer pressure and things like that. And then we also had a second approach, which was to increase the knowledge of health club members on malaria behaviors. So we introduced the malaria pledge. This wasn't new because a previous project by USAID PMI, VectorWorks, had used the malaria protection pledge. They developed it and used it while distributing mosquito nets to school-aged children in schools. So we encouraged the school health clubs to recite, the members to recite the malaria pledge during their meetings. And they even started to incorporate it in their school assemblies. We also used non-monetary incentives to encourage attendance and participation initially. The school health clubs were not the only clubs in the schools, and we wanted to see how we could increase attendance and participation of those students. So we included incentives like the t-shirts or the face caps, wristbands, pens, and notebooks. Next, please. We had other approaches. We also wanted to strengthen the students' interpersonal communication, planning, and organizational skills. So one of the things we did was to introduce a board game called the Mosquitoes and Ladders game. Now we had a precedent from literature that had showed that introduction of word games actually would make a difference in the knowledge and behaviors of children. So the precedent had been a worms and ladder game, and what they did, it was for helminthic infections. And what they did was that they compared between schools that they introduced the board games to and those that did not. And the findings revealed that it was statistically significant for those that had the board games. There was a less reintroduction of the infection. And so we're hoping that introducing the Mosquitoes and Ladders game will be a fun way to start off malaria-themed discussions. We also organized interactive activities like quizzes dramas, games, debates. We even had football matches that we conducted within the schools and between the different schools, just to make learning about malaria fun. The fourth approach was early support for institutionalization and sustainability. We found out that after a while, the students were kind of asking questions about other disease areas. For instance, when the Mpox outbreak happened in Nigeria, they were asking the club teachers, what is Mpox? And so they got back to us, and we started looking for ways to make it even more fun. We involved other health areas in breakthrough action, TB, Lassa fever, and all that, monkeypox. They also sought to join the program and made it even more interesting for the students. Next slide, please. So we had a tool that we used to track the activities as they were being conducted. And generally, the teachers, the school health club teachers, would report on activities across the assembly, across the classroom, and across the school health club itself. And activities were conducted every week of the school terms from the time we started October to 2021 till when we finally had support removed, which was July to September 2022. And on average, 150 activities were reported on a monthly basis. And we're able to reach quite a number of students, according to the chart you can see on the right. We initially, we're trying to engage them and kind of make health clubs interesting. So we had a low output in the first term, but that's shot up. And then it started to decline when the students felt they had learned so much about malaria and the life skills. And then they started to ask about other questions. So we're having a declining till the end of the year. Next slide, please. So at the end of that feasibility pilot year, we conducted an after-action review. We conducted an after-action review because we could not get ethical clearance to talk to the children that were members of the club. However, we got ethical clearance from Johns Hopkins University, as well as the different state ethical committees on an after-action review, which we were hopeful would help us to assess how well the program had been implemented and possibly scale up to other schools and other states. One of the things we asked the respondents based on the perception was the effects of the program on the students, the schools, and the communities. We got really favorable responses where even we were told that there was an improvement in school attendance because of the engaging learning methods the teachers had learned and the students were interested in. We're able to foster that collaboration between the health and the education sectors. And the schools really appreciated the increase in recognition and attention that they received from Ministry of Education. When we asked them what activities they considered most impactful, our mosquitoes and ladders game was top of the charts, as well as the teacher's guide that we had developed for use in the school health clubs. They felt that the life skills sessions particularly were seen as new, relevant, and interesting. Next slide, please. So we asked them, what could we do differently? What do they think would be better done? Like, do we need to combine an elephant with a zebra to make it work? And we got good responses. Of course, they said they wanted more topics. So we developed a new guide to include topics like tuberculosis and Lassa fever and cholera and hygiene. We included a session on climate change and its effects on health. We included sessions on new life skills, planning, managing stress, for instance. They also wanted us to engage the parents better. They wanted us to make more use of the parents teachers associations, to even use the religious organizations better. And they actually were pushing for an integration of the school health club program into the Nigerian school curriculum for a longer term impact. Of course, they wanted provision of adequate non-monetary incentives to further boost participation and effectiveness. Next slide, please. However, we had a number of challenges and we employed some mitigation measures. Some we were able to overcome, some we couldn't when the funding support was removed at the end of that feasibility pilot year. For instance, we found that in several schools, there were no health clubs, but they were open to having it being initiated. So we encouraged the initiation of the school health clubs in all the schools that had none. We also found out that there was a lack of functional and equipped sick bays in the school. So even though we had taught the students and they were interested in, oh, this person has fever and wanted a school club, a sick bay that they could attend, that wasn't possible. We tried to work with other implementing partners. We tried to work with the state government, but this is still a work in process. Nothing has been done till date. We also had a challenge conducting competitions between the schools because of our limited resources that had dwindled. However, what we did was we worked on competitions in schools that were proximal to one another, which made it easier in terms of resources, and we encouraged them to conduct outdoor activities. Of course, that made it more fun for the students. Next slide, please. So what are our conclusions and recommendations for those that are interested in this kind of engagement? Well, we have concluded that school health clubs are very feasible and they're quite sustainable. And when it comes to malaria SBC, since we stopped since we stopped supporting activities as malaria project, the students continued. The school health club is still on. The activities are still going on. They've gotten even other projects that are interested in supporting in one way or the other. So it's running without project support, which is fantastic. We've also been able to ensure that collaboration between the ministries of health and education. And we think this is something that must be encouraged across countries so that the school health clubs can be functional. You can use this, you can experience to leverage on the terms of references, the training, the reporting tools, and the learning mechanisms. I think it's important to emphasize that it shouldn't be a malaria or a one health intervention only. It should actually be an integration with other health areas, and there should be incorporation of the life skills. That was always so much enjoyed by the students. Then it's also important to explore ways to measure change in knowledge, change in perception, change in behavior of the school health club members, as well as the community members. And those school health club activities will be good to link those to community structures that are implementing in health and development activities like media, appearances and excursions and things like that. So we included here a picture highlighting an inter-school competition that was done under the tree, but was totally fun for the children. Next slide, please. Thank you very much. Over.
Thank you so much, Dr. Ushola. As we saw in the Madagascar presentation, protecting school-age children is so important, and in addition to reducing malaria transmission in this group, we also hope to reduce absenteeism from school. In Nigeria, we saw the research that shows not only knowledge, but also attitudes, self-efficacy, risk perceptions, and family support can be improved with school-based SBC. Another unique and admirable aspect of the Nigeria example is the duration of the program. 36 consecutive weeks is a considerable amount of time to absorb malaria prevention content. Both presentations highlight how collaboration between two ministries can be fruitful and how particularly beneficial it can be in terms of sustainability to work with schools. Thank you so much for all the comments and questions in the chat. Please continue to add. We're now going to transition to the question and answer session with today's panelists. So our first question is for Dr. Ushola about the logistics of the program in Nigeria. Sarah and Jesse ask, how often do health clubs meet? Are they after school or during school? And did the intervention target public schools alone, or is it a mix of public and private schools?
Fantastic question. Thank you, Mike. And thank you so much to the asker. So yes, we only targeted public schools. We wanted to, okay, in Nigeria, the public schools tend to have more students that come from the lowest socioeconomic status. And we really wanted to target them because we knew that, of course, the awareness might not be as high as those in private schools. So, but there's nothing wrong with targeting private schools as well, depends. And then the activities were weekly, the clubs were meeting every week. So it was on a weekly basis. That's why we're able to have up to 150 activities in a month on the average. Hope that helps.
Thank you so much. The next question is for Dr. Tiana. Participants Innocent and Irene would like to know, how did you integrate the activity into routine school and classroom activities? For example, getting teachers to work on the activity given their already existing workload. Are there particular activities, interactive activities that you used?
Yes, thank you very much for the question. For us, at the 8th graders, there is already a lesson that they give for malaria. In this class, the students are between 9 and 10 years old. They already have these lessons. Also, in high school and middle school, they have lessons on malaria, and they also have it at a higher level. And it's already part of the program. So during our collaboration, we are collaborating to create new guidelines so that the teachers give a couple of minutes more to explain about malaria, because they already have the guidelines for the teachers, and they are the ones deciding if they're talking about a specific topic on malaria. And after a couple of months, they can start doing this drawing. And it's part of the competition, and it's part of the school participating in this competition and being able to fight against malaria. And they can do that during entertaining days, like in class, and the teacher can do some kind of activities. They can ask someone, why didn't you come to school? And then they can talk about that. And then they can ask, oh, did you have malaria? What did you have? What did the doctor say? And to be able to fight against malaria, you have to create awareness. And you can create this awareness amidst all the students in the school. So they can do this kind of activity. And after the enrollment of the competition, we send all the schools the guidelines to inform them about malaria. And they have different activities, entertaining activities, to be able to teach all the students about the strategic plan on fighting against malaria that is based on the Ministry of Health strategic plan. Thank you. And I
Thank you.
hope I have answered your question, but thank you. That's the way we work.
Thank you so much, Dr. Tiana. Our next question comes from Miriam and Hazel, and they want to know, one of the challenges mentioned was around the follow-up of the adoption of behaviors by school children after the competition. Was this a resource problem? Was post-monitoring or follow-up conducted in the program?
Yes. We have a challenge because not all of the schools are participating in the competition. and it's not effective. Not all the schools are participating in these districts, and not all of the schools decide to participate in this competition. So for us, it's a big challenge because when we have a very remote school, it's very difficult to send the guidelines and all the information about the competition, and they don't get this information. And it's a very big challenge for us. Also, concerning the follow-up, it's the teams from the Ministry of Health that are doing these different missions to do the follow-up on these different schools, but they don't have all the resources, and they don't have we don't have the resources in our activity. Thank you. Also, I will add that when we go see the teachers, we ask them what happens concerning the students, and we can say that the diseases that we are introducing in schools, the ones that we're starting to speak about in schools, we can say that the students are getting more knowledge about these different diseases, and the Ministry of Health is also introducing on the lessons different diseases that are very important here. Thank you.
Thank you. Our next question is for both presenters. Question comes from Miriam and also Dr. Blaise, and we're asking about the collaboration with other sectors. How are you sustaining the collaboration of multiple stakeholders to ensure that we don't have fragmented efforts? You might also speak to the collaboration, how this collaboration was established and how it will continue. Maybe we'll start with Dr. Tiana.
So concerning the collaboration with the ministry, would that be the question?
Yes, how did you initiate that collaboration?
Okay, yes. So we have the authorities at the ministry level, and then we have some activism that we realized at the Ministry of Education. And with them, they are informing us about all the schedule, all the resources that they have to help us with our competition. After this activism, we have different committees. A committee where we are working together to be able to continue our work and check what we are going to create about this competition, and where we are going to do this competition. We do that with the Ministry of Education, and they are the ones that are introducing us to different schools at the district level, because we don't have the right to go to different schools and introduce this competition to schools as we want. We have to do it through them. And there is information that is diffused at the ministry level. They validate our support, how we're going to present the awareness campaign with the children, how we're going to present our supports. And we do it always in collaboration with the ministry. But at the beginning, we meet them at the ministry level and they explain to us. The interpreter is very sorry, we cannot hear the speaker anymore. We have lost the speaker. Thank you.
Okay, and just a follow-up question also for Dr. Ushola, which partners support the setting up the health clubs in Nigeria, and how is this done?
Okay, so my organization is called Breakthrough Action, and we're a project that is funded by the USAID. the President's Malaria Initiative aspect to be specific. So this was funded by USAID. We worked with the states ministries. In the Ministry of Education, there's a state health desk officer that exists. So there was a collaboration between the state malaria control program and that health education desk officer at the state level. And then at the LG, the local government area, the sub-level of the state, we also have the different units that are in charge of health and education. So we brought them together. Remember that I said that we had one of the first things we did was to establish a team called the State Implementation Team that provided oversight over all that was carried out and all the thinking that went into how to engage the clubs and the schools. So that's helped us not to have a fragmented approach. And those were the same, the implementers were the same people that came together to reassess based on our tools, what had been done and the lessons that had been learned and the possibility of ramping it up and wider. I hope this helps. Thank you.
Thanks, Dr. Oshola. We have another question for you. The question comes from Grace. Is the Mosquito Letters game available?
Hi, Grace. Well, it is available. We've already shared with the Secretariat and it's free for use as far as I know. So if it wasn't, we wouldn't have shared it. I think for us, the most important thing is to see how malaria can come down across the world, really. So yeah, it's available and it can be utilized, which just don't want it being sold. Thank you.
All right, thank you all so much. For the remaining questions, we'll ask if Dr. Scholler and Dr. Tina can answer in the chat. So I want to thank the SBC Working Group membership for sharing your questions to Dr. Tina and Dr. Scholler and for the great responses. This has been a great opportunity to understand just how important school-based SBC can be in different contexts. Please share your school-based malaria SBC materials by emailing ashley.riley@jhu.edu. Find the email in the chat. Many SBC Working Group members have already shared resources, all of which can be found at the link on the screen and in the chat. The SBC Working Group Coordinator will continue to update this folder as well and post resources on the Compass for SBC. I'll now pass over the floor to Suze to give some announcements before closing. Suze will speak in Portuguese.
Thank you very much, Mike. I would really like to ask for you to save the date for some of our next events. At the end of this week, we will open the elections for one position for co-president, co-chairman. It will coincide with our two other co-chairs. After the abstracts and the proposals for capacity building developing this year, they have to be submitted until the 29th of May. The next general call will be in July. Very soon we will share the date in our list. And for our general call in July, we would really like to have at least one presentation from a Portuguese-speaking country. So I'm going to ask all my Portuguese-speaking friends to please submit a presentation for our general call in July. Please send an email to our coordinator, Ashley, if you're interested in delivering this presentation about the work you are doing when it comes to SBC of malaria in a Portuguese-speaking country. Also, please remember to save the dates, 11th to the 13th of September, for our general meeting of the SBC GT, which will be in Kenya, Nairobi. Next slide, please. Okay, stay in touch this with the SBC GT. For us to you can see all the information on the slides and in the chat, be it through our website or our email, and also accessing our online commuting of our GT. And you can also see that on Springboard. Next, please.